Hi, guys. Welcome to the Akos Show. My name is Akos, and thank you so much for joining me. So, today I am going to talk about an important issue, something that has been plaguing America for a long time, and it's about time that somebody brings that issue up. A lot of research has been done about it, a lot of, talks have been done about it, but it's still going on, and it's leading to, you know, high mortality rate among minorities, especially black people. What is that? Health disparities. Yes. So that's what I'm going to talk about. COVID, is here and it's killed a lot of people. It's still killing people. It's on the rise. A lot of families have been devastated by this, disease, especially minorities. Well, in minorities, I'm even going to break it down and go, especially black people. Yes. And I have heard a lot, a lot of, justifications and excuses about it. And I want to address all of them and tell you what has been going on in this country long before COVID, raised its ugly head. So, I've heard that COVID is killing a lot of black people in America because black people are sicker. And that's not true. Because there's a whole continent out there full of black people and they are not dying at a high rate as black people here in America are. So that's not true. That can't explain it. Um, I've heard that it's because of a lack of vitamin D. Black people have a lack of vitamin D. That is not true. Actually, that whole lack of vitamin D thing, research has been done to actually explain why black people have lower vitamin D levels and how it actually doesn't really impact our health at all. I would make a video and explain that in details. Really, it's fascinating. I've heard that it's because of genetics. No, it's not. When it comes to genetics, race itself is almost non-existent. Actually, race is a social construct, and in fact, there's more variations within race than between races. So genetic factors cannot explain why black people die at a higher rate in this country than white people. It can't. Other biological factors I've explained, like vitamin D and so many other things. No, those cannot explain. The reason, what they found is that doctors' biases, yes, implicit biases, mainly white doctors' implicit biases against black people leads to or has contributed to a higher mortality rate among black people. Black people were dying from preventable diseases, not because of income, not because of a lack of access to health care, not because of education. When you take all those things into consideration, those still don't explain why black people in America die at a higher rate from preventable diseases. Those don't explain why black people in America have shorter lifespans. Those don't, and they found that it's mainly because of white doctors' implicit biases. Wow. I'm not making this video to blame doctors and call all white doctors racist. That is not my intention and that is not my goal, right? My goal is to highlight a public health issue, that actually can be fixed, right? And to also bring awareness to a lot of people do not know, a lot of patients, a lot of, people are not aware of this. And we can stop this if we all, patients and clinicians, physicians, if we're all conscious of, our biases and patients understand what high quality healthcare is and how they're supposed to be treated, I think they can help doctors check their biases. And it will lead to higher quality care for everybody, and actually lower quality, and lower costs, right? It will, because when everybody's healthy, it affects everyone. I always say my health is your health. And COVID is proof that my health is your health, because my health problem, if it's an infectious disease, can quickly become your health problem. But if I'm healthy, then I am not going to catch something and spread it to you. So we all, whether you're black, you're white, we all need to actually pay attention to this. I made this video because we're out there, we're protesting, police brutality, we're protesting injustices. you know Police brutality is killing our children, it's killing our mothers, our brothers, and our sisters, and we want it to stop. There is, however, something that's killing black people at a much higher rate than police brutality, and that is white doctors' implicit biases. They call it implicit bias, but to me, honestly, I'm like, okay, it's not like doctors don't know that this is there. It's not like doctors are not aware that research has been done. Actually, the Institute of Medicine in 2005 did research on implicit bias and how it leads to lower quality care for black people. So, white doctors who were given the implicit bias test, they were given white faces and black faces, and they were given pleasant words and unpleasant words. Under intense pressure, they were asked to associate, the faces with the words. Most of the white doctors associated black faces with unpleasant words, and they associated white faces with pleasant words. Yeah, this is not me just saying it and stating something out there, because we like talking about race, we like making everything about race. No, it's, out there, non-profit, non-governmental organizations, psychologists, so many institutions have done research on this topic, and they've all come to the same conclusion. They have. So, doctors are aware of it. They know that this is happening, and it's increasing. So why are we not talking about it? Doctors kill black people. Well, I wouldn't say kill, that's a strong word, not intentionally, but by not giving somebody quality care, you contribute to their deaths. True. So when it comes to like cancer, for example, black women don't get cancer as much as white women. Let's say breast cancer. White women get more breast cancer than black women. However, when black women get breast cancer, they die from it the most. Yeah, and it's been linked to white doctors' implicit biases. It's the same thing for black men and prostate cancer and other cancers, right? The thing is, when black people go to black doctors, they have a higher chance of surviving. However, when they go to white doctors, they're more likely, or their chances of dying from a preventable diseases go up. I am not making this up. This is fact. This is research that has been done, right? And I am not making this video to call all white doctors racist. I am just simply pointing out a public health issue that shouldn't even be so, really, because doctors go to school and they take an oath to help everybody, right? You don't take a note to help one group of people, or give one group of people quality care while they give the other group lower quality care. They don't. We can change this. We can, right? Doctors are humans. We're all humans, okay? And we all have our preconceived notions about people, about things. because we're shaped by so many things, as humans. When you're growing up, you're shaped by, your parents, by your environment, your church, your experiences, right? I myself used to hate one type of people because a person did something to me that was very traumatic. And so I started hating anyone who looked like that person. I see them and I immediately associate them with negativity and harm. I had to work, I had to consciously work on that to overcome that. So, doctors are humans, they've been shaped by so many things. I also know that they went into medicine to be able to help people. And as humans and doctors, the thing is that regular humans, when we have biases against people, most of the time it doesn't lead to harm or death. When doctors have implicit biases against patients, it can lead to death. Death, someone's life. So you went to medical school, you took an oath to save lives. But you're also human. And so let's bring awareness to this and help doctors check their biases. Again, I am not saying that, white doctors are racist, okay? I am not. I am just pointing something out that is has been plaguing America for a long time, as a matter of fact, This research that I'm talking about, right, by the Institute of Medicine, they're now called the National Academy of Medicine, it wasn't done yesterday. It was done in 2005. Yet, disparities in healthcare in America continue to rise. So it means that, somebody's not getting the message. So if doctors are not getting the message, and let's give the message to the patients. Let's educate patients on their rights, on what quality healthcare is, to, spot biases, call doctors out so that, patients can actually contribute to their own healthcare. After all, isn't that what doctors are kind of like adopting these days? Patient-centered healthcare. Yeah. So, as a patient, if you go to a doctor, make sure that they listen to you. If they're not listening to you, if you sense that doctor is not, paying attention to you, dismissing your claims, or just not giving you quality care, go to someone else who will give you care. Go to someone who will treat you with respect and dignity. Keep going until you find someone. If you can't find someone, contact me. I will find you a doctor who will treat you with respect. Because you deserve respect. You go to these doctors, they get paid. Why would you pay somebody to not give you quality care? Why would you pay somebody to give you inferior quality care? Right? Be aware of what quality care is. Pay attention. As humans, there's energy. We feel the energy. When you go to a doctor and they're listening to you, you can feel it. You can feel the connection, right? Don't take a doctor's word for it just because they're a doctor. A doctor is not God, okay? They're humans, okay? They don't know everything. They actually don't even know most things, So they go by, certain rules, certain research and things like that. But it doesn't mean that they know everything, right? So if you feel like that doctor is not listening to you, point that particular thing to the doctor. Say that I feel that you're not listening to me. I don't feel like you're listening to me, doctor, right? And get a second opinion, get a third opinion. Keep going until you find someone who will listen to you. And doctors, I am not making this video to paint white doctors as bad people. That's not my intention. But I am making this video to kind of like shine, or the light on that issue, because it's out there and we know that it's happening, yet it's increasing. So it means that you guys are not getting the message, especially white doctors. Doctors don't listen to women in general. So if you add race to it as a factor, as a layer, then black women, yeah, doctors don't listen to black women at all. When it comes to pregnancy and mortality, right? Maternal mortality um, rate is high among African Americans and Native American women, and it's all due to, it can be preventable, and it's all due to doctors' biases. Simple as that. It's sad that in America, you know, one of the richest countries in the world, people are going to die from preventable diseases because of their skin color. It shouldn't be so. It shouldn't be so. So learn, educate yourself on how you should be treated, on what quality care is, and make sure that you're being treated with quality care. Because it doesn't matter. As I said before, even rich black people are not being given quality care by white doctors. It shouldn't be so. We can change it. I have this thing that I use to check my goals, or to check how I did at the end of every day. I'm a very introspective person. So at the end of the day, when I'm in bed, I start to go, I have a checkbox, and I check, and I'm like, what did I do today? Did I do it right? What did I do wrong? How can I fix it? How can I, things like that. I can give it to any doctor who wants one, right? And I'll call it check your biases. Seriously, contact me if you want one. It's not, taking one from me is not an admission to being racist or anything like that. You're human. And we come with our biases, right? It's taking one from me just means that you are willing to change. You want to make a change. You want to make a difference, right? You're like, you're wondering. You want to ask yourself, do I have implicit biases? Does that, come out or affect how I treat my patients? Seriously, every doctor should be asking themselves that, regardless of their race, right? And so, mainly white doctors. I think one of the most dangerous things is white people who have implicit bias thinking that they're not racist, because then you're in denial, and in your conscious mind you feel like, boop, I'm doing the right thing, but our unconscious minds affect our conscious minds. So when you're treating a person in front of you who's black, and you have implicit biases in your unconscious mind, you're thinking that you're doing right, but you're not. How you're treating them is being affected by your unconscious mind. Yeah. So think about that. Have something on your computer. It could be just a little note on your computer, on your file, on something that will ask you, have you checked your biases today? Have you checked your biases today? This patient who came to you, this black patient, did you give her the highest quality care to the best of your ability? Did you do that? Ask yourself, regardless whether you know that you have unconscious biases or not. Every doctor should ask themselves, did I do right by this person? Did I abide by my oath? Did I treat this person with equality? Did I give them the best advice, the best care, the best resources, to the best of my ability? Did I do that? And by doing that, and by patients reminding doctors and questioning doctors, and pointing doctors, flaws and their mistake to them, I think by doing that, we can all work together to minimize this. We can't stop it. I mean, statistically, I don't think, yeah, we can't. But we can reduce it. And, it will lead to, it will save a lot of lives. it will save a lot of lives, because there's no reason why a black person should die, a black child, a black mother, black father, a black brother should die just because of the color of their skin, because you are not treating this person with dignity and respect. So this person ends up dying. It shouldn't be so. And we can all help change this thinking. We can all do that. So patients, make sure you call your doctors out. Make sure that you let them know if you feel like they're not treating you with equality or they're not treating you with care. Don't be afraid. Make sure you tell them. And doctors, please receive it with kindness, because it's our health, our lives. We're mothers, we're fathers, we have families. We want to live, we want to be able to contribute to American society. But we cannot if we're sick. We cannot if we're sick and we come to you and you don't treat us right. We cannot if we're dying off at a higher rate. So help make it better. We all deserve life. We all deserve respect. We all deserve higher quality care, regardless of our income, regardless of our background, sexual orientation, culture, regardless of our skin, regardless of our race. So we can all do it. We can all do it if we highlight the issues, come up with solutions, and work together. All right, guys, thank you so much for listening. Make sure you comment. If you have any questions, please do. I will answer them. Like, subscribe, and share. Thank you. Bye.